All right, chapter 10, part 2. We are going to go into lifestyle and health. So, cigarette smoke is a toxin mixed with more than 7,000 chemicals. Some of the harmful chemicals found in the tobacco occur naturally in the plant, while others are absorbed from the soil, the fertilizer that is used in order to grow the tobacco plants. We're seeing a high numbers of the vaping illnesses that is causing your lungs to bleed or crystallize. So I hope that if you are vaping, you're doing it in more of a responsible manner and not getting these fakey oils that make it taste good. Because the fakey oils are containing, I believe they said vitamin E, which is causing a chrysalis to occur within the lungs and making them collapse. So just please be very, very careful what you put in your body. This even goes with marijuana. If you don't get marijuana from an actual store or a clinic, you can be getting poopy marijuana that has other things that are added to it, or it's grown in horrible soil that's causing actually chemicals to go into your system. So even though people say marijuana is healthy, man, so is tobacco. Tobacco is just a plant, and they add all these other chemicals inside of it, just like some marijuanas. So the number one cause of preventable diseases and deaths in the U.S. are directly related to over 400,000 deaths each year of smoking. Smoking related to can cause heart diseases, lung cancer, chronic bronchitis, and many, many other issues. Alcohol abuse. Alcoholism is severe. If you have someone that you know is an alcoholic, or if you are an alcoholic, do not try to wean yourself off or go into detox on your own, because it can actually cause you to die. With excessive alcohol consumption, this can damage virtually every organ within the body. So your liver, your stomach, your heart, and your brain. CT scans show brain shrinkage in alcoholism. So shrinkage is apparent even when no cognitive loss is yet noticeable. So this is a normal 43-year-old. This is an alcoholic 43-year-old. Can you see how the brain is actually shriveling up at this point? Because the alcohol is causing all the nutrients to be sucked out of your brain, that's causing it to shrink. So within your assignment for your lecture, I was wanting you to write down what may cause brain shrinkage and what is the amount of time that this brain shrinkage actually can occur. So how long do you have to be an alcoholic for this to happen? So this one kind of makes me laugh. It's not funny, but it kind of makes me laugh. So compared to non-alcoholics, alcoholics are 3 times more likely to die in a car accident. Really? That's kind of obvious. They're twice as likely to die of cancer. Yes, because we're damaging literally every single vital organ in our body. Brain imaging techniques and genetic predispositions for alcoholism. So if you have a strong line of alcohol abuse within your family, you're more likely to actually continue with that abuse. So brains of alcoholics respond differently to visual and auditory stimuli than those of non-alcoholics, probably because we have shrunk our brain. Since the 1950s, the AMA has actually referred to alcoholism as an official disease. Just like any drug abuse, alcoholism, it's an addiction, and then the addiction is very strong and it causes it to be a disease or a disorder. With some of the drugs that are used or alcoholism, you have to have medical guidance when you are going to detox or trying to get away from alcoholism or the drug abuse. This kind of looks like beef jerky, huh? This is your healthy liver. This is a liver with cirrhosis. So just think, if you are a severe drinker, this is not just drinking here and there at parties. This is consuming lots and lots of alcohol each day so you can survive the day. This is what your liver is going to look like. So this is what your beef jerky is inside your body at this point. A healthy heart versus an alcoholic heart. So this is your normal heart. With alcoholism, it causes fatty alcoholic heart. So when we have alcoholics come in, we have to be on watch for strokes. We have to be watch of heart attacks, obviously, lung collapses, everything. You can die. I've had a couple patients that have actually died in my chair because of alcoholism. So this is what your heart looks like if you continue to drink lots. STDs. So STDs have increased a lot. They have gone rampant. So the reason why they have gone rampant is because we're more permissive towards sex. Instead of being only married and having sex for the first time, people are just banging it out before they get married to multiple different partners. They're not using barrier methods of in order to not have babies. So non-barriers, so condoms or inner barriers, they're not being used as much, which is causing a lot of STDs to be transmitted from partner to partner. And we're having a lot of activity now, starting at a very young age. There's two different types of STDs. We have your bacterial STDs, which is cured with antibiotics. So it's transmitted through physical contact and involving the genitals of intercourse. So this is chlamydia, your gonorrhea, or your syphilis. Your viral STDs are considered incurable. So this is your genital herpes, genital warts, so your human papillomavirus virus, and your HIV and AIDS. So your HIV and AIDS are acquired immune deficiency syndrome. So AIDS is caused by infection with the human immune deficiency virus, HIV. So two major advances in treatment, so AZT can prevent the transmission of HIV from a pregnant woman to her fetus, which is massive. Drugs have prevented millions of deaths of interfering with HIV's ability to invade healthy cells. So our individuals who have been diagnosed with HIV or AIDS are living longer because we have the drugs to help stop the multiplication or the duplicates of that disorder. The number of new cases of HIV and AIDS in developing regions have leveled off, so we don't see a high level any longer. So HIV is transmitted primarily through exchange of blood, semen, vaginal discretion during sexual contact, and intravenous, so drug users. Almost 1/3 of new HIV cases resulted from heterosexual contact. Circumcision reduces the risk of HIV transmission because it doesn't have that fold in order to sit there. Presence of another STD in HIV-infected persons causes higher levels of the form of the virus in his or her body fluid. So if you have one or more, it's more likely to develop faster. Please use a condom. Think wisely before you get in bed with somebody. Think about your future, your health, and your future partners as well. All right, that's chapter 10. Bye.